Hello, and welcome to the Breakdown with Dr. Muni, where you can learn about your health, your body, and how it runs for absolutely free. If you haven't already, go ahead and hit subscribe. Now, today we are going to be talking about another hot topic. We've already covered measles and we've covered the flu. Today we are going to be talking about whooping cough, also known as the 100-day cough. What is it and why do we care? Whooping cough levels are on the rise and poses a huge danger to our communities. Whooping cough is a very highly contagious respiratory illness that spreads very quickly, which means that it's very easy to catch. Whooping cough, also known as pertussis, is caused by the bacteria Bordetella pertussis. What makes this different from measles or the flu or COVID is that those are viruses and this illness is caused by an actual bacteria. It attaches itself to these tiny hair-like extensions in your respiratory tract called cilia. It attaches to these cilia and releases toxins, also known as poison, into your respiratory tract. It then causes the walls of your respiratory tract to swell, damages the lining of your respiratory tract, and causes excessive mucus production. That mucus production and the swelling is what makes it so hard to breathe and irritates your entire respiratory tract, which is why you end up with this telltale whooping cough sound. Whooping cough sounds like this. Like flu and measles, however, this is transmitted through respiratory droplets. So what does that mean? It means if somebody is infected with whooping cough and goes, achoo, and releases particles into the air, they are increasing the chance that everyone around them becomes infected with whooping cough. Now, the trickiest thing about whooping cough is that your symptoms can begin anywhere from 5 to 21 days after your original exposure. You are considered infectious from the start of your symptoms until 3 weeks after. That means that you could potentially be infectious for a full 4 weeks. It can affect all age groups naturally, but the biggest age group that will be negatively affected by whooping cough and its long-term side effects are babies. Babies less than 1 year old can potentially suffer long-term irreversible harm from whooping cough. They may struggle to breathe with a cough or may not ever develop a cough whatsoever. Additionally, patients with pre-existing conditions, pregnancy, asthma, COPD, or other autoimmune conditions or immunocompromised can also become severely ill from whooping cough. I repeat, this is not a common cold. Whooping cough is known as the 100-day cough for a reason. There are generally 3 stages of the whooping cough infection. The first stage is the common cold stage. This typically lasts for 1 to 2 weeks and is indistinguishable from the common cold. You'll have itchy eyes, runny nose, a very mild cough. You might feel malaise or just extreme fatigue. You may feel under the weather, but you will not have that telltale whooping cough sign. Your fever may not rise to astronomical levels like it would with measles. You might have a mild temperature of 100.4 or no fever whatsoever. In phase 2 come the coughing fits. That causes that stereotypical whooping cough, gasping for air kind of sound that we recognize with this illness. This phase typically lasts between 1 to 6 weeks, but has been known to last up to 10 full weeks. This stage is characterized by thick mucus that is so hard to clear, as well as inflammation of your entire respiratory tract. Due to this thick mucus and the swelling, you're going to have a severe cough. Now, these coughing fits are really what becomes very dangerous and deadly because you will continue to cough, cough, cough. You can cough 12, 15, 30 times in a row and never be able to fully catch your breath. These coughs may become so ferocious that they cause you to throw up, get headaches, or even pass out. These episodes can be triggered unexpectedly by anything. Laughing, crying, eating can cause these very severe coughing spells to take place. Also, they do tend to be worse at night. The last phase is the gradual recovery phase. This phase is characterized by a cough that is becoming more mild and coughing spells that are becoming farther and farther apart. If you do the math, you count up 1 to 2 weeks, 1 to 6 weeks, and with the recovery phase being several weeks after, you see why whooping cough is known as the 100-day cough. It is important to note that during this very lengthy recovery process, you will have a compromised immune system. You will be at a higher risk of contracting one of the other viruses or illness that is circulating through the community. So if you are struggling with fighting whooping cough for 100 days, that's 100 days that you're more susceptible to the flu, to COVID, to measles, or any of the other viruses or illnesses that are circulating in our communities. That's what makes this condition doubly dangerous. It's also important to note that a full recovery is not guaranteed for all patients that develop whooping cough. This is not a simple cold that will come and go. For infants and small children, as well as immunocompromised patients, you can develop pneumonia, pulmonary hypertension, migraine, malnutrition, fainting, rapid weight loss, encephalitis, permanent brain damage, or death. That is correct. Whooping cough can kill you. So, unlike our viral infections that we learned about, such as measles or influenza, you actually can take antibiotics to treat whooping cough. Antibiotics are the solution for whooping cough. I say this in air quotes because azithromycin, lovingly known as a Z-Pak, is the treatment that we give to prophylactically treat a patient for whooping cough, i.e., they've been exposed to whooping cough and they want to get ahead of their symptoms, or for patients who are in the early phases of their disease process. However, I will emphasize azithromycin does not get rid of the cough. It doesn't reduce the severity of the cough. It doesn't reduce the frequency of the cough. Once you have whooping cough, it's up to your immune system to battle that infection. The azithromycin may decrease your length of illness by a short while. However, there is not really much that you can do to decrease the ferocity of this cough. Whooping cough is something that is entirely preventable if you get your whooping cough vaccine at regularly scheduled intervals during childhood and during adulthood. This is completely avoidable. If you choose not to vaccinate for some reason, I do at least ask that you wear a mask if you have a severe cough and also wash your hands. You would be surprised how many illnesses we could prevent just by wearing a mask, sneezing to ourselves, and washing our hands. So when should you seek care if you think that you have whooping cough or someone you love has been exposed to whooping cough? The second that you confirm an exposure, call a doctor immediately. If you hear your child have this type of cough, please call your pediatrician. Do not take your child into the clinic without giving somebody notice. I repeat, do not show up to any clinic or emergency room with a whooping cough unannounced. You will potentially be endangering the lives of dozens of children. If you suspect that you have whooping cough and you'd like to be treated, seek a telehealth appointment or call the doctor's office or hospital in advance. If your infant or child has blue discoloration around the mouth, they're working extra hard to breathe, or they are having severe coughing spells that make you feel uncomfortable as a parent, please take them in to be evaluated. That's all for whooping cough right now. During our next adventure, we're going to be talking about polio. Thank you for tuning in. Until next time.